Good evening, dear viewers, and good evening, Abdullah.
Good evening, Dr. Fatma, and good evening, dear viewers. Welcome to a new episode of Medical Talk, the program that brings you trusted medical knowledge to help you and your family live healthier lives.
Children often express their emotions in ways that can be very challenging for parents, especially during the early developmental stages.
Temper tantrums are a common part of childhood, but sometimes behaviors may go beyond what is considered normal.
Understanding the differences between typical behaviors and warning signs of deeper issues, including possible abuse, neglect, is very essential for parents and caregivers to know.
So early awareness can help protect children and support their emotional and psychological well-being.
So here to help us better understand this very important topic, we are welcoming Dr. Zainab Alsahhaf, Senior Specialist Pediatrician.
Dear viewers, stay with us. I'm Abdullah Al-Ajmi.
And I'm Dr. Fatma Al-Ansari, and you are watching your weekly program, Medical Talk.
Welcome back, dear viewers, to Medical Talk. Today we have the honor of having Dr. Zainab Alsahhaf, a pediatrician and a member of the Child Protection Team. Thank you so much for being with us
Thank you
today.
so much for having me.
Thank you, Dr. Zainab, for being here. We're going to discuss a very important topic that concerns a lot of parents and caregivers.
Yes, it's an honor to be here.
Thank you.
Dr. Zainab, we're going to talk about temper tantrums.
Yes.
Is it considered a normal part of childhood development?
Yeah, well, temper tantrums are actually, in most cases, considered a normal part of development, and there's nothing to worry about. They're basically, episodes of emotional outbursts where you see your toddler and young child like throwing themselves on the floor, kicking and screaming, sometimes throwing things. And this can happen when the child is tired, did not sleep well, they're frustrated, because during that stage their verbal skills are still not well developed.
Yes.
So they cannot really express what they want, or they cannot really communicate effectively, so sometimes they resort to temper tantrums. But
That's
I would,
their way of expressing
themselves. But I would like to reassure parents again, this is not a disease. It's not considered, bad behavior. In most cases, it is normal, and most children will outgrow that phase.
So, Dr. Zainab, how can parents differentiate between tantrums and other sorts of behaviors that could be alarming to the parents and caregivers?
Yeah, that's a very excellent question. See, temper tantrums, as you have said, it's common in younger children and toddlers, and the episodes is usually short. It's not frequent, and they do not really continue beyond a certain age. Like, for example, most of the cases by 4 or 5 years of age, they will disappear.
Grow out of it.
Yeah, they will grow out of it. However, if you notice that these episodes are becoming increasingly more frequent, or they become very intense, or it's difficult to control the child, you cannot calm them down, they did not go back to their baseline, or if they persist beyond a certain age, and if you notice other associated behavioral issues, like, for example, the child becoming increasingly aggressive, there is other signs and symptoms of developmental delay, like, speech delay, any sort of regression in previously acquired skills, if they exhibit some, hyperactivity, autistic features, then they need further evaluation just to make sure everything is okay.
For sure, definitely.
Dr. Zainab, can you tell us what can trigger these tantrums, and how can parent learn or maybe manage these triggers if they exist?
So the triggers are actually very simple. Whenever the child is, for example, tired, they did not get enough sleep, or they're hungry, they're frustrated, they're angry, they can go into a temper tantrum. So the trick here is always to have a consistent routine for the child, because younger children, they need consistency and a specific routine for their emotional regulation. So as a parent, always be ready. Make sure your child gets enough sleep. They have regular meal schedules. For example, if you are expected to go for example, a hospital visit, you are expected to wait for a long time to avoid boredom. Always, for example, pack meals, take the kids' toys with you, or drawing to keep them busy, because also boredom can lead to temper tantrums. So just make sure you stick to a specific routine and don't disrupt the child's routine, and you should usually be okay with that, and you can avoid the temper tantrums.
Now, Dr. Zainab, you mentioned from the year 1 to 4.
Yeah.
Usually that's a normal behavior.
Yes.
For children to have tantrums.
Yes.
Now, what would you say after the age of 4?
Yeah.
When is the red flag? Do we give parents another extra year or 6 months that it would be something, oh, we cannot ignore this behavior and should be followed up with a specialist?
Yeah, so it's not really about a specific age. You know, most cases are common between the ages of 1 to 4.
Yes.
The peak is around 2 to 3 years of age.
Definitely.
And as we have mentioned previously, the majority of tantrums, they will resolve or become very minimal after 4 or 5 years of age. However, it's not just a specific age. You need to look for other signs and symptoms. It's a combination of signs. So any alarming behavior, any red flags in behavior, if you see sudden behavioral changes, your child becoming increasingly aggressive, there is abnormal movements, or as we noted previously, there is some delay, regression. If you have any concerns about your child development and behavior, then you should speak to your pediatrician and get your child checked.
How about, doctor, like depression?
Yeah.
Like totally the opposite, because you mentioned hyperactivity
Yeah.
or being very aggressive.
Yeah.
What if it's totally the other way around? Being isolated and depression.
Yeah.
Is that also alarming and not normal?
Yeah, definitely it can be a concern. You know, you have to be very observant of your child's behavior and notice any changes, because the signs or indicators that your child is going through an issue or having a problem can be very subtle.
Yes.
So you have to really have that, you know, good connection and bond with your children, and able to notice any behavioral changes. So as you have mentioned, if they either become more aggressive or hyperactive, or on the other end, they become increasingly withdrawn,
Yes.
anxious, fearful, there's changes in their moods, depressed, this also can be very concerning.
Well, Dr. Zainab, thank you for these valuable informations for the kids' behaviors. But dear viewers, we have still more questions for Dr. Zainab, but after this break. Welcome back, dear viewers, to Medical Talk. We're still with Dr. Zainab Alsahhaf, talking about an important topic, which is child behavior. Dr. Zainab, is there any signs or warning signs people can figure out that their child is being abused, or any potential red flags that people can recognize?
Okay, so when speaking about abuse, unfortunately, child abuse, neglect, and maltreatment has been very common, more common than we expected. So it's very important that every parent, caregiver, teacher, healthcare provider, everyone in the community, anyone who works with children, they should be aware of the red flags or the signs and symptoms that the child might be a victim of any form of abuse. Some of these signs to watch for: behavioral changes. Again, if you notice that the child suddenly becoming more fearful, they are scared of specific places or scared of specific people, if they're becoming more anxious, if there's changes in their mood, they're becoming depressed, if they're becoming impulsive and involved in high-risk behavior, and you see that with, especially with teenagers. We don't usually see that with younger children. You notice them being impulsive, You know, they can be oppositional towards their parent, they can be defiant. And also, if you notice any regression in previously acquired skills. For example, if a child started wetting their bed at night after a period of dryness, so they were completely normal, then suddenly this issue happens. This can be a red flag. If you notice a young child is speaking words or talking in a language or that is inappropriate for the child's age, this can be very alarming for parents. So you really have to watch for these signs because they can be very subtle. They are not really usually obvious. And also at school, monitor their school performance. If there is sudden deterioration in school performance, or they're suddenly becoming isolated, not playing with friends, this can be a red flag.
Thank you, Dr. Zainab, for that information. It's very, very informative, very helpful. So how does exposure or to abuse or neglect can affect the child's emotional regulation and behavior?
Well, you know, children who are exposed to a toxic, unhealthy environment, and they are continuously being victims of any form of abuse and neglect, this can have many detrimental psychological, emotional, and even physical consequences. There was a very groundbreaking study that was done years ago by the CDC. It's called the Adverse Childhood Experiences.
Okay.
They studied the effect of adverse childhood experiences, like being brought up in a family with domestic violence or experiencing any form of abuse during your childhood, and their connection with mental, psychological, and physical illnesses in the future as adults. They have noticed that adults who were abused as children, they have increased risk of all forms of mental health issues, increased risk of anxiety, depression, sleeping disorders, and even some physical illnesses like increased risk of diabetes, obesities, autoimmune
Even
disease,
in
and so
adulthood,
yes, it can last way into adulthood, and it can be damaging for a person's life if it was not managed properly.
Dr. Zainab, what is the correct way for parents to respond to the tantrums that their child is having without affecting them physically or emotionally?
Okay, that's another great question. So the way to deal with tantrums is to anticipate and avoid the triggers. This is the most important thing. Always be ready, as noted previously, be ready, stick to a consistent schedule, make sure your child is well fed, he's getting enough hours of sleep, avoid any situation where the child might be bored or frustrated. And another important thing is, you know, children, they will learn by imitation. So always model calm behavior in order to calm your children down. So when a child or a toddler goes into the tantrum, I always tell parents, don't panic. I know sometimes it can be embarrassing, especially when it happens in public. You see it in, you know, family gatherings and supermarkets. But always calm yourself down. Remember that the child is not doing this on purpose. Make sure the child is safe, he's in a safe environment, and try to be emotionally responsive towards your child and try to calm them down. So that's the best way to deal with it. You can also use distraction. It has been shown as a good method to redirect their attention.
So you don't advise ignoring, because you know some parents, they follow the advice of ignore the child. I personally don't like it.
I'm not a fan of honestly of ignoring children because, you know, children, they are longing for a connection
Yes.
with their parents. They thrive on that emotional response, especially during the early stages of development. And it can be very important for both their emotional and cognitive development to have a strong emotional bond with their
Definitely.
parents.
So lots of hugs and cuddles.
Yeah, lots of hugs and cuddles and kisses, definitely.
So Dr. Zainab, what are the biggest mistakes caregivers might actually do unintentionally, and then they could cross that thin line between being harmful and causing harmful and abusive behavior to the child?
Well, you know, most parents and caregivers, they don't really intend to harm their children. But, you know, with stress and frustration and lack of awareness, some responses, unfortunately, are not helpful, and sometimes they can be harmful.
Yes.
So the first thing you have to understand as a parent, when your child is throwing a tantrum, they are not doing this on purpose. You shouldn't blame your child, or you think they're acting out just to, you know, make you upset or to embarrass you in public.
Yes.
This is just a normal part of being a child and
Normal
a toddler.
part of their development.
Yeah, and it's a normal part of their development. So they're not doing that on purpose. You have to understand that. So don't resort to shouting or perhaps physically punishing the child. This is completely unacceptable. Or, you know, humiliating them, resorting to physical punishment. And again, as an adult, you're the adult here.
Yes.
You're expected to know how to emotionally regulate and not to resort to physical punishment or humiliation as a method of discipline, because this won't work.
Yes.
And don't have unrealistic expectation of your child. You have to understand that this is the normal behavior of young children, because, you know, some parents, they want like a 2-year-old toddler to be completely well behaved, and they stop running around, or they speak in a specific or very poised
Yes.
and composed all the
This is
time.
normal.
This
If the child is like
of
that,
course,
that's
definitely, this is
if
abnormal.
it's the child born like that, it's normal. Definitely.
Exactly.
If it's a child.
But this is unrealistic expectations.
Yes, not all
So
of them are like
you
that.
have to understand that each developmental stage has specific behaviors that are considered normal. And as a parent, you have to develop the skills to deal with that stage effectively.
Dr. Zainab, thank you so much for these valuable insights about raising a child and how to do it properly. Dear viewers, we still have more questions for Dr. Zainab, but after this break.
Hello, dear viewers, and we're back with Dr. Zainab Alsahhaf, Senior Specialist Pediatrician, and our topic, of course, is about children's tantrums. So, Dr. Zainab, if a parent or a teacher or a doctor suspects child abuse, what steps should they take immediately?
That's a very important topic. So since child abuse cases are on the rise globally, every individual in the community should be able and should be equipped with the skills to recognize and also report cases of suspected abuse. And it's actually the responsibility of each individual in the community. Everyone is mandated by law to report cases of suspected abuse. And note that you don't have to confirm your suspicion.
Yes.
Even if you have less than 1% suspicion that this child might be a victim or subjected to any form of abuse and neglect, it is your responsibility to report it. And thankfully, in Kuwait, we have the child protection team in each hospital. It's a very competent team, including multidisciplinary professionals. We have physicians, social workers, clinical psychologists, and they're all highly trained in dealing with such cases. We have a hotline, 147. You can contact that line, and all the reportings are anonymous. So the identity of the individual who reported the case is kept anonymous, and all the cases are dealt with high professionalism and with the utmost privacy and confidentiality.
Wonderful. Thank you, Dr. Zainab, for
You're welcome.
informing us about that. Honestly, I didn't even
Yes,
know.
it's very important for
even me, I didn't even know. Again,
yeah.
it's the hotline
147.
147.
Thank you, Dr. Zainab.
Dr. Zainab, how can we teach a child emotional regulation without preventing them from speaking up what they're thinking about?
Okay, so again, we go back to the point where us as adults and us as parents, we have to know how to emotionally regulate, because younger children, they will learn by imitation.
Yes.
They will not learn by dictation.
Yes.
So
We have to be an example.
Exactly.
First.
You have to set an example for your children. So enable to teach your children how to control their anger and emotionally regulate and calm themselves down. You have to model that behavior yourself. And another thing, always create a safe environment for your child and open communication. Facilitate open communication with your children where they can express themselves freely without fear of judgment, without fear of blame, especially with teenagers. Because, you know, this is a very sensitive stage. If you don't open up with your children and develop a trusting relationship with them, you might lose them. Okay, so keep the communication channels open with your child, keep your home a safe environment, teach them how to freely express themselves. And even with younger children, instead of verbal expression, you can use play, you can use drawings. These are all methods to help your children express themselves and emotionally regulate. Help them to name their feelings. This is after they calm down and the tantrum resolve. You can teach them ways to name their feelings, or you can choose, the different emojis or smiley faces with expressions to express the emotions they are feeling right now. You can teach them some
and practice honesty.
Excellent. Okay, you can practice honesty, and what you can do also, you can teach them some breathing exercises if that helped. Teach them some tricks to deal with stress. So these are all methods to help your children emotionally regulate.
So definitely a lot of conscious parenting needed.
Yes.
Well, Dr. Zainab, thank you so much. I'm sure these information are gold to any parent who are watching us right now on KTV2. Well, dear viewers, this brings us to the end of this interview with Dr. Zainab Alsahhaf, but we still have more segments coming up on Medical Talk after this break.